very, very critical that we really continue to open up all venues so access to information is made explicitly available to all of our ethnic media. That has been something that I have been pushing for the last 6.5 years that I've been serving on the board here. And I'm excited that sometimes it takes a tragic moment in our history, whether it's the pandemic, COVID-19 that's upon us, that actually requires us all to come together. And this is very important for our families and our communities so that they get the information based upon the individuals that have the best mode of being able to articulate and get that out in a culturally and competent manner. And so I want to applaud everybody that has joined us today. And I especially am very, very encouraged to see that our county offices are taking part in this messaging, because they're the true validators. They're the ones that have the information that has to be given to our community. Now more than ever, it's very necessary. And I want to thank everyone for joining us, all the ethnic media groups that have been following us, but also have joined us today. Hopefully this is one of many events that will happen, and we'll continue to bridge that communication gap so that we can make sure that every ethnic group receives appropriate information. I know that this is very important because there are many people that we represent in the county that may not have their first language as English. So we do have to articulate, whether it's in Spanish or Armenian or Tagalog, whatever that is, we have to make every effort to see that people have the same access, that our standard is equitable across the board. And I think it's very impactful right now because of COVID-19. The fact that we're seeing the impact on the people of color, immigrant communities, essential workers represent I would say, a large number of people that have contracted COVID-19. And unfortunately, many of them right now are in need of help. Today, I want to introduce, and you'll be hearing from them, Dr. Tasha Dixon. She's the lead physician at Martin Luther King Jr.'s Outpatient Center, and Erica Flores Uribe, the emergency medicine physician and lead on the COVID-19 testing access equity effort, which again is very important. We're talking about equity, and both are with the Department of Health Services, and they'll discuss exactly how healthcare needs and services are being provided throughout the County of Los Angeles and how we've been able to pop up testing and outpatient care throughout the county. You're also going to hear from one of my good friends, and that is our director for the Department of Public Social Services, known as DPSS, and that is Antonia Jimenez, who will also be speaking to you. Antonia will share really critical information to talk about protections for tenants during the crisis, including access to cash assistance, food assistance, and healthcare coverage through Medi-Cal. And she knows very well how impactful this is to get those services out to our community. But I want to also just mention that the reason why I'm taking this so personal is because in the first district that I represent, unfortunately, I have over 107,000 people out of almost 400,000 people that have contacted COVID. 107,000 and growing each day represent the first district. That is astronomical. And for me, it's unacceptable. And we have to find a way to bring down the curve of COVID by incentivizing our community to take advantage of all these healthcare services. And more importantly, understanding how to speak to our community. Because as you well know, the demographic that is most impacted right now are those that are 18 to 49 years of age. That's the demographic. And there are well over 232 cases of COVID right now. And out of the 414 and 185,000, those cases are positive. And that's why we're having to go through tremendous strain right now to restrict our involvement outside and making sure that we adhere to the social distancing, using the mask, making sure that we get tested, and to seek any assistance that the county and other healthcare providers might provide for our community. Now, time is of the essence. And all I can say is that right now, between the African American, Latino, and Native American community and Pacific Islander community, we have the highest rates of COVID. including our healthcare providers, many who are women, who this is their sole source of income, having that job, but many get up every day to go out there to fight the good fight, and they're doing it for our community. So we also have to make sure that our community respects what is going on, and to also respect those healthcare providers. That's really what the essence is. We've done a lot already in the county, but we know we need to do more. And one way of doing it is by having a good voice that will come together to articulate our concerns to the state, as well as to the new federal administration that's coming in, because we do need a lot of support, monetary support, so that we can bridge the gap and make sure that we minimize those disparities. So I would just say that it's a wake-up call for us today. And I know there's going to be more news that is going to be made available here in the state of California. But ¿sabes qué? We are one community. We are one family. So we have to work together. And we now, more than ever, have not to be afraid. I know people are anxious. I know people are hurting. But we're going to do everything in our power to see that we can try to mitigate any issues that they have.
This is the first time in many years that, and I think that the county has ever seen, where we have people for the first time ever who have to apply for food assistance. And so you can tell the need is out there. And so we're very happy to be able to share this news stories with you and help you, help us get out the word out that these services are there and are available to the public. The Department of Social Services administers both federal, state, and county funded programs for people who are in need of nutrition, healthcare, cash assistance, homeless, and employment-related services. We provide essential services to about 3.5 million people in LA County, so 1 in every 3. DPSS is the largest county public social services in the country. We know that families who are just getting by, barely getting by, and living paycheck to paycheck before this pandemic have been the hardest hit during this crisis. We have seen an increase in food insecurity, which is a lack of access to affordable food. We know that 1 in 4 Los Angeles County households experienced food insecurity between April and July, which was higher than what we have ever expected. We had a 187% increase in CalFresh applications in April and March alone. In October, DPSS provided over 1.3 million people, including 487,000 children, receive CalFresh, which is our nutritious food program, benefit program. For many, CalFresh is the first line of defense against food insecurity. As one of the county's most effective anti-poverty program, CalFresh helps low-income households access food. Families throughout Los Angeles County, as I said earlier, for the first time ever, are applying for CalFresh benefits, just simply to help put food on the table. For instance, in April of 2020, we received 126,875 applications, which actually increased from the number from 79 to 82.3%. In contrast to April of 2019, our department only received 45,468 applications. So you can see from one year to another, we went from 45,000 to 127,000. These increases were the result of the stay-at-home order that was issued on March 19, 2020. As a result of this pandemic, a record number of people have seen their wages either go down due to working less or have just lost their jobs in general. Hunger impacts all aspects of human life form, from healthcare to education, and it's the utmost importance that we let people know about this CalFresh program. The eligibility to qualify for CalFresh, I'll just give you a quick rundown of some of the major eligibility requirements. So you do have to be a U.S. citizen or a legal resident. You have to be low-income individuals whose monthly income before taxes and other deductions fall under the limit of the household size. So for instance, a household of 4, your grossly income cannot exceed $4,200. Or people with limited property, meaning individuals who do not have a home, do not own a car or may not be working, those individuals also may qualify for CalFresh. We want to get this number out because we just issued, we launched a call center, intake call center, so that people just have to call us. We accept the application. If we can verify your your information through our hubs, we have a lot of databases. We can actually approve your CalFresh case on the same day. If you call our call center, we have a 70% same day approval for the individuals who contact us. And the number is put on the screen is 866-613-3777. We've extended our hours. We used to be open 7:30 to 5. We're now open 7:30 to 7:30. And we also just launched a Saturday's hours from 8 to 4:30. For those individuals who want to apply online, it's a very simple application if you go to calfresh.org. And so in conclusion, in addition to CalFresh, or I should say our call centers speak 10 different languages. They speak Spanish, Armenian, Chinese, Korean, Talaga, and a few others. In addition to CalFresh, DPSS administers healthcare services through Medi-Cal and Cal assistance through CalFresh and General Relief. The CalFresh General Relief is for individuals and CalWorks is for families. For more information about our programs, you can visit our website at dpss.lacounty.gov. And finally, just follow us on social media as we put out a lot of information that changes as the state makes changes and the federal government makes changes. And so your partnership with us is essential in making sure that the most vulnerable population have access to all of these services. And I really want to thank you for doing that, for getting the word out, for communicating with people that are hard to reach for us, but it's your audience. And so we really want to get this information out.
Thank you so much for the opportunity to speak with you today. Thank you for leadership from Supervisorial District 1 with the Honorable Hilda Solis, the Office of Immigrant Affairs, Ethnic Media Services, all the leaders that are on the call here from the hyperlocal segment and reporters. I think it's really important to have this space where we can reach our communities and reach our communities in the way that they access information. So I wanted to start with just saying a little bit about where we are in terms of COVID-19. This information is certainly led by our partners in the Department of Public Health, but I think it really exemplifies what we're seeing today. So a lot of these graphs will show the difference between where we were in March or mid summer in terms of where we are today. The thing that I want to highlight for those who are on the call today is that the numbers are going up alarmingly. We know that about 1 in 200 people are infectious with COVID-19. So for example, if you go to the grocery store, put gas, connect with people, there's likelihood that you came in contact with someone who has COVID-19 and could have been exposed. This is true not only of the cases, this is true of the percent positivity. So this is the people who test positive and have COVID-19 in terms of the testing that's going on in the community. So you can see we went from a low number to a much higher number now at 7.3%. These are the highest numbers that we've seen sometime even in the beginning of the pandemic. And we're also seeing this in terms of our hospital systems. We see that the hospitalization here is now at an average at about 2,400. So compared to July, when we had that one of our other surges, we're about 2,000. So now this really kind of creates a conversation in terms of how many people can we take care of in the hospitals? And generally speaking, when we see the numbers to this rate at 2,400, about 1 in 4 need intensive care. They need care that requires them to have more specialized and trained doctors and nurses and equipment, including ventilators. So what I really want to highlight as we think about these numbers is that it's really going to take all of us to make sure that we're doing everything we can to reduce the spread. It means wearing our face masks, staying home as much as possible, staying 6 feet away. The hospital and its ability to take care of all sick people, not only COVID-19 sick, those who are sick with COVID-19, is an important question that I think is on a lot of our minds, not only for LA County, but for the country. And for the Department of Health Services and ICU care, right now we have enough beds. We have enough beds to take care of those who may come in and have sickness that is pretty severe or even require that intensive care. But this all depends on how we do in terms of making sure that we can stop the spread of COVID-19. As you know, taking care of someone like myself as an emergency doctor, it's not only about the space to do so, it's about being able to have the doctors, the nurses, the staff that are trained, and the equipment. So we have learned in the last several months, and we have prepared. We have created plans to make sure that we can not only create space in terms of beds, but also create opportunity to get everything that we need, including the trained doctors and nurses and equipment. But all of that is, is a concrete, it's a number that could become limited if we don't do everything that we can now to reduce the spread of COVID-19. The biggest thing that I want to say is we really want to make sure that the communication about resources, about preventative services, about testing is reaching the communities, particularly the communities that are most impacted by COVID-19. We know that this is really hitting our Latinx, Black, Indigenous populations, and the majority of the groups that we discussed earlier in terms of numbers, not only in cases, but in mortality. And I wanted to share a little bit of a story in terms of how we're seeing this on the ground and why this might be happening. I know that we've talked a lot about access to medical care and resources, multi-generational housing and limitations to isolate and quarantine. We've also talked about a lot of our community members being essential workforce and not being able to work from home, for example. But I also think a lot of this is a reflection of institutional differences in racism and lack of accurate information. During the summer, there was a forum that was held by a radio talk show. And I think that really exemplified how community is resorting to even accessing information. Maggie Carrillo Vasquez is a 10-year-old girl who called onto one of these national radio shows to get information for her parents. Her parents are both essential workforce. They worked for McDonald's. They got sick. They had questions about how do they take care of themselves? How do they isolate? When can they go back to work? And Maggie was the one calling to ask the questions because her parents didn't speak English. I think that this is not an isolated situation. And in fact, this was very similar to how I grew up with my family. We're a young family. My parents immigrated from Mexico, and we straddled across how to access that information living in Southeast LA. And even now, as an emergency doctor, I see this with the patients that I care for in the ER, where a lot of the gaps have been in being able to know where to go for information and where to go for resources and services. When I tell a patient that they're positive for COVID-19, the next question isn't quarantine and isolate. The next question is, who do you live with? How many people live there? How can we make sure that we have a plan to take care of you and your family? And I feel very grateful to work in a county and a department where from the emergency department, I can refer someone to quarantine and isolation. And I'm also very grateful to know that the county has made this available as a resource to community members. So if they live in multi-generational housing or cannot quarantine and isolate for whatever reason, they can call a number, and I'll display that here so that they can get access to that quarantine and isolation. Maggie's story and the stories of my patients really highlight the measures that a lot of our community members are having to resort to access basic information. I think that it's really important to think about not only the cultural relevancy and the language of our communities, but also that it's coming from those who we trust. I want to acknowledge that there are many front lines to this pandemic, as our partners at DPSS and OIA, our hospitals and ERs that are our front line of caring for our communities, and extending beyond our hospital walls are our community partners. Community-based organizations share culture, language, life experiences of the communities who we serve and are most impacted by COVID-19. They've earned the trust of our families and our community members in their work around social justice. On Wednesday, LA County partnered with the Department of Health Services and the Department of Public Health to launch a community equity fund. This is a fund that will support about 50 community-based organizations to help spread the word and information on COVID-19 resources in the hope to prevent and decrease the spread of COVID-19 in their communities. These community-based organizations will be our partners in sharing information of a range of services like outreach, education, and in some cases, contact tracing, but also system navigation. And it will be really coming from the community. We are really excited to partner with community partners, community-based organizations, and philanthropy around this work and this opportunity to really collectively uplift those that are hardest hit and address the immediate needs of our community during this time. I acknowledge that the testing access is a very important piece, but it's not the only way that we're thinking about how to care and support our communities during this time. I do want to share an update and where we are and how we have grown over the last several months as a system in terms of testing access. So testing is available in the community. We always want to highlight that this testing is available free of charge, regardless of immigration status, will not be part of a public charge. This is one of the things that comes up a lot in terms of barriers, but it is accessible to anyone who requires that COVID-19 testing. Certainly, if community member has a primary care doctor, we're encouraging community to go to the primary care doctor so that we continue to hold that ability to test more in the community who don't have any other way to access care. You can call 211 to get an appointment for testing, or you can visit the COVID-19 lacounty.gov testing website. This is the number for self-referral to quarantine and isolation, and you can see that the line is available there. So community members can call if they require that, and that's a little bit more in terms of our community partnerships. How we have grown is that there's over 180 testing sites across LA County. Our goal is really to integrate these into highly impacted communities. And we're constantly thinking about how can we bridge that gap in access, including mobile testing, for example. Walk-up sites are available, so community members don't need to have a car. They'll have to register either through 211 or through the web page, but you can see that there's some walk-up sites available for community members. And then the testing site also has an array of information on resources. So I think that this really kind of delineates some of the things that we wanted to share in terms of, where we are as a system, how we're thinking about equity and testing. Again, with testing, we're always thinking about how to make this more accessible. So in the next week or so, we're going to launch this learning opportunity in terms of at-home testing. So if people visit our site and meet, apply for an at-home test, they'll get a test delivered to them that they can take themselves at home and then return back. This is with a smaller launch during the holiday season because we're seeing so many numbers come up. This allows us to kind of bridge gap and be able to provide more service. It is currently on the online platform and in English. So I want to acknowledge that creates some access issues, but we're working really hard to make this accessible in Spanish and in other languages in the very short future. You know, the virus is impacting all of us, not only me as an emergency department doctor and seeing what this means in the community, but our families, our communities. It'll continue to impact us in this way until we have a vaccine and kind of work through all those pieces on the vaccine. There is promising news about COVID-19 vaccines, but we're not there yet. And I really want to make sure that it's communicated to our communities that we all need to do everything that we can to keep ourselves safe and secure. And, you know, I hope they can lean on the county and we can be there for them during this time.
So I just want to reiterate, you know, what Dr. Flores Uribe left off on, that, you know, our hospital system today really is able to meet the demand. Right now, we've got 24% of our patients in ICU beds, and 13% of those patients are on ventilators. We've got the beds available to care for your needs now, but we all have to do our part to really limit the spread so that we don't end up in a situation for both our patients and our staff. And coming from an outpatient perspective, which is where I work, I am the lead family physician at Martin Luther King's Outpatient Center. I'm also a clinical assistant professor for Charles O. Drew University, where I also oversee the residency clinic for our training physicians here at MLK. You know, in terms of services, we've noticed over the last 9 months some bit of a dip, you know, in patients coming in and not knowing that we're open. And so I wanted to take this time to really encourage what I want our constituents and our residents of Los Angeles County to know is that Los Angeles County is here to provide services, outpatient and at the hospital. We are open. Our urgent care centers are still open, fairly regular hours. I know here at MLK, we're open 7 days a week from like 8 until midnight. We are still seeing every other medical condition that you may have, including COVID. And so we don't want anyone to stay at home thinking that we're not here to take care of your diabetes, to take care of your high blood pressure, to address your cholesterol or sexually transmitted diseases, and screening and birth control. We are here to provide still those services. Just a glimpse into some of the other services that Los Angeles County Department of Health Services can provide. Is actually going to be mental health services. Many of our facilities are co-located with mental health services, or they're nearby on campus. We also, like for example, at my site, we have legal partnerships. So we have the ability to refer you for legal services for whatever may be coming up for your for issues related to COVID or issues related to no longer being able to work due to your job, losing your employment, or due to you getting the COVID infection. We also, regardless of immigration status, we're able to provide these services. So we don't want you to shy away if you are needing services, regardless of immigration status. In regards to the type of patients that we're hoping to see here in our outpatient services, we're hoping for anyone and everyone. Please remember to keep up with your preventative services. So your breast cancer screening, your cervical cancer screening, your colon cancer screening. This pandemic at some point will get better, and we want to make sure that we haven't neglected your health in this time. I have been concerned in the last 9 months myself personally that I haven't seen some of my patients. And when we reach out to them, they say, oh, we thought that you were closed. And so that's a myth. We're open. Please continue to take your medications. Please continue to take care of yourself and find creative ways to do so. One thing I've heard is that patients feel like they can't go outside and exercise. And so I tell them that the good thing is that they can put on some music at home and dance. And you don't have to leave the house. And so finding creative ways to still stay healthy and still take care of ourselves in the midst of this pandemic is really what I'm advising all of us to do, not just the patients, but the frontline employees, the reporters, everyone alike. in regards to things that I'm worried about over the last 9 months, seeing how this has happened, I'm really concerned that we simply still aren't taking it seriously enough. We're now at the worst point that we've experienced thus far in the pandemic, and it's really time that we take every single precaution that we can to protect not only ourselves, but every one of our loved ones. I look at this like it takes a village to raise a family, and it's going to take a village for us to get through this. And so what does that mean? That means physical distancing. That means making those small sacrifices right now so that we don't have to make them in a year from now. It means the hand hygiene. It means keeping your hands washed, keeping hand sanitizer, on you at all times. So literally, even at work, I have hand sanitizer that's on my ID badge. So I'm keeping it around me, not just expecting to see it, up around as I'm walking. Making sure that if you have symptoms that you get tested. I'll repeat that again because I can't emphasize the importance of that enough. If you have symptoms, please get tested. One myth is, it's allergies. I just have a cough from the allergies. We're not here to guess about it. Let's know your status. Testing, as Dr. Flores-Uribe has said, is widely available. My site is one of the sites here that offers walk-up testing, and so that is available for any and everyone, regardless of immigration status, regardless of language, and regardless of insurance as well. We can take care of this for you. The other thing I'm worried about is hospitalizations moving forward. So Dr. Flores-Uribe gave a very detailed report on our data. Thank you. And the one thing that I want to say is our flu shot, influenza. That is something that we're worried about moving into the flu season. The flu shot is something that I am highly encouraging every Los Angeles County resident to consider getting this year and to actually get. We already got our flu shot. I got mine myself. I get the myth that people say, well, it makes me sick or I'll die from it. People die from the flu, not from getting the flu shot. We're worried this year that as COVID hospitalizations continue to rise, as we're seeing, that hospitalizations due to influenza may take away some of the beds that we'll have available for patients that are impacted by COVID. And so I am urging every person to get their flu shot this year. Flu shots are also readily available at Los Angeles County facilities, my facility included. You can get them also at local pharmacies. Call your provider, come to a local Los Angeles County facility, or feel free to go to your pharmacy, but get your flu shot like yesterday. And then the last thing I wanted to talk about briefly is COVID fatigue. So we're all exhausted, as a frontline worker, as an outpatient provider. I see the long-term effects that this is taking on patients, the depression that has happened, especially in our elderly population, where they're not able to see their grandchildren. They've missed the holidays. They're now they're not able to socialize with their friends the way that they used to. I had one patient that used to, an 80-year-old that used to go and walk up the hill and down the hill to get lottery tickets every day. And to see the decline in his happiness and his emotions it was devastating. It's broken my heart. And I see so many of those countless stories, so similar to that, time and time again, that, I just want us to know that if we do our parts now as part of the village, that in a year or two from now, we'll be back to a new normal that's closer to what we were last year. Frontline workers, we're not immune to the fatigue. You may see the smile on my face, but I'm not immune to it either. My grandmother will be having her 80th birthday in about a month, and we were very excited, and we've been planning that over the last year and a half. And literally, we're having to cancel those plans. I can't even travel to hug her. And she's someone who raised me as a daughter of a teen mom and a daughter of a nurse. See my family. I live here in Los Angeles, and my mother's here, but the rest of my family lives in other places. And so, we're not alone. we too share in the experiences of we're having to stay at home and not working. Black Friday is a thing that I've enjoyed for the last 20 years of my life, that I stayed at home for the first time ever. So we're in this together. Know that, frontline employees, and I just want to say thank you, not only to the doctors and nurses, but thank you to the custodians, thank you to the clerks, thank you to the secretaries that make this all work for us. We're really in this together. And if we continue and do more of our part, I think that we're all going to be okay in the end.